Welcome to Arthritis Broadcast Network's second year of Greek to Street, an initiative started around the Knowledge Translation Canada Scientific Meeting. We believe the magic behind good knowledge translation is getting language and ideas that sound like Greek out to the street, so people can put scientific knowledge into action in our everyday lives. Follow us online at #GreekToStreet. My name is Anita, and today we are excited to welcome back Rosmin from Alberta Health Services. Welcome, Rosmin. Thank you for speaking with us again. Can you tell us a little bit about yourself and what you do at Alberta Health Services?
Thanks so much, Anita, and it's a pleasure to be part of this interview again as part of the KT Canada meeting that will be taking place next week, in fact. So I'm the Provincial Trauma Epidemiologist, and I work with trauma services across the province of Alberta that is part of Alberta Health Services. My role within this in this capacity is to provide epidemiological support for trauma data, to manage the trauma registry, to assist with quality improvement projects, and also to enable trauma services to provide the best care and services to its patients through the collection of high quality data.
And you're presenting a poster called A Knowledge Translation Theory Model of Framework for Health Technology Reassessment, Does One Exist? Can you tell us a little bit about your poster and what the key takeaways from your poster is?
Sure. So for those of you who don't know what health technology reassessment is, it's basically reassessing technologies, whether they're medical devices or diagnostic tests or drugs that are currently being used in the system to ensure that they are being used optimally. And as part of the process, there are sort of four outputs when you complete a reassessment process. You either increase the use of the technology or adopt it. You decrease the use of the technology. You either de-adopt it, so you completely remove it from the system, or there's no change, and things remain at status quo. And health technology reassessment is important because it improves patient care by providing less exposure to technologies that might be harmful, less exposure to ineffective technologies. It also, by reassessing technologies, allows us to allocate resources towards interventions and technologies that are more cost-effective. And in a much more broader sense, it allows us to manage the technology from its entire life cycle, from innovation to implementation to reassessment. So it's kind of a broader perspective. And for the healthcare system, ultimately, it's, we live in a world of finite resources, and it allows us to use our resources more effectively. So my poster is looking at, okay, well, that's fine. We're doing health technology reassessment, but how do we actually make the recommendations from our health technology reassessment implemented? How do we implement them and make them happen? And I'm actually tapping into the field of knowledge translation and looking at whether the field of KT, the theories, models, and frameworks in that field could actually be used to implement recommendations from a reassessment process.
And how does this work help or impact patients?
Right. So, recommendations come forward from a reassessment process that could be to increase the use of a technology around particular indications. Or it could be, that we should decrease the use of a technology around a particular drug, for example, and only look at it for certain indications and not a vast majority of indications. And so basically it's around making sure that whatever technologies we have in the system, we're using it to provide care for our patients in an optimal way. so that there may be some technologies that won't be beneficial to all patients, such as getting, X-rays for low back pain. And so, we want to make sure that those patients that really need the X-rays and maybe really need the MRIs should get them. And so we provide guidance around that, and that's what the reassessment process does. But in order to make that happen, you need to tap into behavior change strategies and knowledge translation. And that's really where my poster is coming in, to kind of see, well, what are some of the models we can use to help influence that? Because often it's much more harder to take away something from the system than it is to introduce something new. People don't want to give up things, and so this research is really looking at, well, what are some of the nuances we have to look at, and how do we make that really happen so that change is embraced and effective and translated into practice.
And do you think this model will be applicable across all disease fields, or do we need a specific model for specific diseases?
That's a really great question. Through my work, I've actually found about 36 theories, models, and frameworks that could be used for the reassessment process. And through an expert review, I narrowed it down to about 16. And I'm just actually doing some international consultation with experts across the world to see which models could be used. But the models have been used in different contexts, so some in cancer, some in chronic disease, some in public health, and so it's a variety of contexts. And my goal is to make the model general, but that you can actually adopt it to whatever context you're looking at. So the question is still out there, and I'm still doing my research to figure that out.
Okay, we look forward to seeing the models online when it's published, or hopefully you can share where people can learn more about your research.
Absolutely. I'm just in the process of publishing my very first paper on the B6 models, and so just trying to get that out, and so that will definitely be available. And hopefully next year I can do another interview and really share the results and culmination of my work.
And for this year's KT Canada event, their theme is Advancing the Science of Integrated Knowledge Translation. What does this mean to you?
For me, I think integrated knowledge translation is the crux of doing all of our work, which helps us put research into practice. And it's not about, a lone researcher working in their office by themselves, but integrating with those that are going to be impacted by the research, the knowledge users, whether they're the policymakers, the clinicians, and of course the patients. So for me, I think it's the way to go when we're doing KT. We have to involve the people that are actually going to benefit and use the knowledge from research from the beginning. And that's what integrated KT means to me. And I think it's absolutely critical that we get input from those decision makers, policy makers, clinicians, patients, when we're forming our research question, when we're developing the methodology, when we're analyzing the results, and when we're actually translating that knowledge and presenting those findings, ensuring that input is there at every single step. And that's what integrated KT means to me.
And if you were to look into a crystal ball, where do you see this field of research in 10 years?
I hope that we won't be still talking about, more and more knowledge translation models. I hope that we have progressed to picking, some of the best ones that are out there that we can use, and really the research will be on how they're working in the real world. I think that's where researchers need to go, is actually start using them and practicing them and providing data as to, how the models are working and what changes we can make to them accordingly. And part and parcel of that, again, is, doing integrated knowledge translation when we're using these models and involving the knowledge users from the beginning of the research, so that we no longer have to talk about integrated KT. It just becomes normal language, everyday language that we use. It's not researchers separate and users of research separate, but it's all one. We're just part of one kind of system where we can work together and try to advance research into practice.
Great. Thank you so much for your time today, Rosmin, and good luck at the KT Canada meeting.
Thank you so much. It's been a pleasure to talk to you again, Anita, and I look forward to sharing my knowledge with everybody next week, and wishing you the best of luck with the rest of your interviews.